Hello, everybody. How are you all? Hope you all are doing fine at home with your loved ones. As we all are aware, the COVID-19 pandemic is upon us. So with us today is Dr. Jonathan Yeap, who is our emergency physician with Columbia Asia Hospital, Petaling, Jaya. Hello, doctor. How are you?
Hello. Hi. A very good morning to Sakina and all the audience.
Good morning.
I'm fine. Good morning.
Let's start with our first question. We are going to talk about COVID-19 screening today. So when can you come for COVID-19 screenings?
Okay. Basically, for under the latest MOH Ministry of Health 5th edition guideline management of PUI patient that should go for COVID-19 screening is those that have symptoms. So the first thing is they must have either one of these symptoms: fever, or cough, or sore throat, or difficult breathing, with one of the other risks, which is either history of traveling or residing in another country in the past 14 days that have COVID cases. Second is those have contact with a patient that have confirmed COVID test positive. The third is actually any history of attending to an event that have a positive COVID cases. So if presence of symptoms with one of the other risks, then this person is indicated for a COVID screening. The patient actually can go either to a government hospital or a private hospital.
Okay. Can you describe who should come for COVID-19 screenings?
Okay. So basically, like I say, those with those criteria above, but generally COVID-19 infect all age group, but it causes more severe infection and higher death rate, mortality rate in those that with risk factor. For example, old age, if their age is more than 65 years old, children less than 2 years old, those that have chronic medical problem, diabetes, hypertension, chronic kidney disease, chronic lung disease, those are the patients that actually have higher risk of getting COVID-19 infection, more severe form.
I see. Okay. Can you describe to us what exactly is the procedure for the COVID-19 screening? Is it painful?
Okay. Okay. So basically for COVID-19 screening test. Sorry.
So that we give a bit more time for all attendees to commit to this presentation.
Just wait until the sound goes off.
So sorry. Basically for COVID-19 screening, a person will need to undergo COVID-19 reverse transcriptase PCR test. So basically is they have to do a nasal pharyngeal swab. That means a swab from the nose, and also an oral pharyngeal swab from the throat. So before the procedure start, the patient will be screened through some question regarding the COVID-19 screening that I've mentioned earlier, those that have symptoms, the risk factor. After that, the doctor will actually explain to them regarding the procedure, the indication, the common complication from the procedure, and then we will do the procedure. So after we do the nasal pharyngeal and the oral pharyngeal swab, so
I'm sorry, doctor, because
we'll put the swab in a special media.
I'm not sure what that is, but I'm so sorry, ladies and gentlemen. Maybe Dr. John so that our voices can be on top of the background noise. I'm so sorry about that.
Yeah,
you're saying just now about the business?
Yeah, basically after you're doing the nasopharyngeal and oropharyngeal swab, you'll be put on a virus transporting media. So after that, triple packaging will be done, and then it will be actually be sent to the lab for analysis. So the whole process, if you ask me, is painful or not, it will cause a bit of mild discomfort. Sometimes it can also induce coughing and sneezing to the patient.
Yeah, because I have seen some on social media. There are pictures of people who are actually doing their screenings. Like, for example, a friend of mine, she was actually describing that it was just a little uncomfortable, but right after it's done, then it's discomfort disappeared. So
Yeah.
that's true. I mean, it's just like just
Sorry. Can repeat the question? Sorry, pardon. Can you repeat the question again?
okay. Sorry, the source of the sound. I think
Yeah.
maybe we're not aware that we are actually recording. Okay, it's okay. Anyway,
Okay.
yeah, as I was saying, we have seen some pictures and videos on social media about
Okay.
how some of these screenings have been done. So some of it look quite alarming lah, because you have this long something
Yes,
like
correct.
for a swab that you have to stick to somebody's nostril, and I don't know how far back that goes. So that looks painful, but apparently some people say that it's not painful. It's just a little bit uncomfortable, and the minute you remove the swab, then you're okay. So
Yes,
is
correct.
that what's done, that you actually do need
Yes,
to?
correct. So basically, when we are doing the nasopharyngeal swab, especially, so the swab actually need to follow the floor of your nasal canal, the nose, so that it won't pass through the other structure. So it won't cause painful if it's done correctly. So it just cause a bit mild discomfort, but it's generally not so painful. Don't worry.
Yeah. It's just that like the perception when you think that somebody's going to be poking something through your nostril, but of course that's just visual lah. Doctor, how long is the screening? Does it take quite some time?
Okay. Basically, for each patient for the COVID-19 PCR swab test, it roughly takes about 15 to 30 minutes for one patient. So after we take the swab, we will actually send it to the lab. And for the lab, usually for one test result, to get a full analysis of the RT-PCR COVID-19 test, it takes roughly about 6 to 7 hours to have a complete analysis of the result.
Oh, you mean you can have the results on the same day?
Yeah, not the test will run 6 to 7 hours, but depending on the lab number of sample that they are receiving. So currently, because of the pandemic outbreak, there's a lot of sample that they sent to the lab. So the fastest result will roughly take about 24 to 48 hours. But generally, for one test, when they do, it takes 6 to 7 hours to have a complete analysis.
I see. But the procedure itself, the moment that the swab is being done, that one just takes a few seconds, right?
Yeah, the swab itself is very fast.
Correct.
1 minute maybe. Yeah, but for us to prepare after taking the swab, we need to actually put the swab into the virus transporting media, the proper packaging of the sample and labeling. So that will the whole process will take about 15 to 30 minutes. But the swab process itself is only for less than 2 minutes.
Oh, I see. Okay. Do you ever see any reaction from the patients who actually, when they do the test, right after they remove the swab, do they feel like throwing up, or do they have to, retch?
Usually it's just the commonest is actually sneezing and coughing, but otherwise there's no other major complaint from the patient. Yeah.
I see. Okay. So it's basically just a simple process lah.
Yes, correct.
Yeah, of course. And then maybe you can just advise, since we are all here at this stage, if you can just let us know what are the things that we can continue doing since we have been hit by this pandemic.
Okay. So basically, if you are having any symptoms like cough, sore throat, fever, so if you are going out, please wear a 3-ply surgical mask, wear in a proper method. Second thing, you need to actually wash your hand regularly, at least for 20 seconds each time, more regular than usual. And then if you are, do not touch your nose, your eyes, your mouth with your hand. And then if you are sneezing or coughing, you need to actually cover it.
Okay.
So also maintain social distancing, at least 1 meter apart from each other. And then if you are unwell, if you think that your fever is progressing, your cough is not improving, seek medical advice. You can actually call your family doctors, your nearest hospital, then seek for their advice. Then you can actually go to the nearest hospital as well. Okay, and lastly, the most important thing, like our Prime Minister and our DG say, please stay at home.
Yes, of course, that would be the best thing to do. Okay, Doctor, thank you very much for your input. We shall see whether there are any questions. Since this is a live telecast, then maybe members of the public can leave your questions in the comment section below, and then we will try to address the questions as they come. Okay, we have our first question by Ms. Hsiung. Hi, Dr. Jonathan. With the increasing severity of COVID-19, government has been encouraging the rakyat to use more on e-payment, but some shops are still using cash money. My main concern is, can COVID-19 be spread through banknotes and coins? That's a very good question. What do you say, Dr. Jonathan?
Yeah. Okay. So firstly, we must understand that COVID-19 spread by droplet. So from respiratory droplet. So basically from a person that is coughing, or a person that have COVID-19 that is coughing or sneezing, this respiratory droplet will it will transmit through this respiratory droplet. So another thing is that if, let's say, this respiratory droplet contacted to a surface, and then the healthy person actually touch the contaminated surface and then touches their nose, their mouth, so they might get infected to it. But if but currently there's from WHO, they say that there's no evidence to actually suggest or dismiss it. But most important thing is that if we have touched the money, so we actually need the banknotes. So we actually need to wash our hand regularly and make sure that we do not touch our nose, our eyes, our face.
Yeah. Some of them actually, when there is an antiseptic spray, whenever they come back from anywhere where there has been exchange, whether it's plastic bags or money, they will lay everything out and then they will just spray. Spray with the disinfectant, which works as well. That
one is for any item that if they are worried, then they can actually do that.
Correct, yeah. Car keys, access cards and whatnot. Okay, thank you, Doctor. From Lim Hoi Chien. Hi, good morning, Doctor. May I know how to go about if I would like to do COVID-19 screening? Is there any specific timing for that? And as well as the cost, please? Thank you, Doctor. Perhaps you can relate this to Columbia Asia Hospital, Petaling, Jaya.
Okay. Hi, thank you for your question. So basically, in Columbia Asia Hospital, Petaling, Jaya, the COVID-19, we are doing our COVID-19 screening test on every Monday, Wednesday, and Friday from 9 a.m. to 4 p.m. So basically the price is roughly about 450 ringgit. 450, 460 ringgit. So you can actually make an appointment to come and to do the test by calling our customer care number that's available on our webpage and website.
Do you have to go into the hospital when you need to do, or is
basically all the patient they have to go through the screening counter, which is at the entrance of the hospital. So they need to actually be screened through the question, and temperature will be taken for them, and then they need to fill up a declaration form. Then after that, they will be diverted to the isolation tent, which is located just outside our emergency department. So we will actually attend to you at the isolation tent, and the swab and the COVID-19 testing all will be done there.
Okay, so a special area has been set up lah?
Yes, correct.
Okay, and I'm sure they still practice social distancing there, even though there would be some people waiting around.
Basically, the waiting area, we have already arranged the chair at least 1 meter apart from each other. This is basically to prevent the COVID-19, the social distancing at least 1 meter.
Yes, of course. From your experience, Doctor, when you see people coming in, oh, wait a minute, we have Miss Josephine Hsiung. Hello, how are you, Miss Hsiung? Good morning, Dr. Jonathan. Thanks for a very simple and clear see, because XGM, so I'm nervous a bit. Good morning, Dr. Jonathan. Thanks for a very simple and clear explanation on how the RT-PCR test is being done. Our DG had mentioned that there is plan to use the rapid antigen test from Korea. Can you let us know what is the difference between this test and RT-PCR? And will Columbia Asia Hospital PJ be doing this rapid test? If so, how much? Thanks, Dr. Jonathan.
Okay. Good morning, Ms. Josephine. So basically, to make it simple, when a virus actually enter to our body, so basically it's an antigen. So the Korea rapid test, what our DG actually mentioned is antigen is basically to test the antigen, which at early phase, the most important thing is actually to test the antigen. So it's faster. So there's the RT-PCR test. Basically, it has to go through the genetic. We have to go through the genetic link, the sequences of the RNA virus. There's also another serology test, basically to test the IgG and IgM, but that is basically at the later on of the disease. As we all know, COVID-19, our body actually have a slower response to produce antibodies. So usually by around day 9, the IgM will be elevated and IgG will be elevated. So basically, the rapid test for the antigen, this rapid test can actually test the antigen early at the early stage of the disease.
I see.
So,
for those of us who are not sure what those acronyms mean, maybe you can explain what is it, RGG and all that.
Okay. So basically, when the COVID-19 virus enter to our body, it mainly affect the respiratory tract. So enter our upper respiratory tract, then it will go through our lower respiratory tract, and so basically it will from the lower respiratory tract into our alveoli, our basic cell of our lung. So it will actually go into the one of the type 2 pneumocyte, the cell. Then it will go into the cell and it will replicate its RNA. It's a single-stranded, so it will multiply. It's like some sort of like photocopying the virus inside the cell, and then it will release out. And then when it releases out, then it will cause the immune response. That is when our cell will recognize it and then produce more antibodies.
I see. Okay. Well explained, Doctor. Thank you so much. Okay, from Ms. Trista Tam. Hi, Doctor. My father decided to undergo knee surgery, which had led to severe pain in recent weeks. However, with the current pandemic situation, I am kind of worried. Is the hospital a safe place to go nowadays? And are there any special protocols or precautions that the hospital has applied in order to safeguard other patients?
Hi, good morning, Ms. Rista. So basically, I think hospital is safe. For Columbia Asia Hospital, we actually already have a protocol to deal with COVID-19 management in the hospital. So all patients, including the visitor, they have to actually be screened through at the screening counter at the entrance. And at the counter, they will actually be screened through the temperature and also some question regarding their symptoms and the risk factor like I mentioned earlier. And they actually have to fill up a declaration form. So those patients that have respiratory symptoms or suggestive of COVID, they will actually be sent to the PUI area, the isolation tent area, and those that negative, then they can actually enter the facilities. So that is one of the way that we have done to actually try to reduce. Other things is basically we have a dedicated area we also maintain social distancing. If you see all the chairs at our OPD and also in our emergency department, so we actually have separate into 1 meter apart. We have put a label that you cannot sit at that certain area. So we have designated seat that you can sit on it. So thirdly is basically on we have a timing for frequent disinfection of the commonly touched area, like example, the lift button, the tables, the places where usually there's a lot of people contact. Then we also advise our staff to wear masks and also to wash their hand regularly. That will actually help. And for Columbia Asia PJ, patient that going for operation, admission and operation, they are also required to do a COVID-19 PCR test. So basically, to make sure that the patient doesn't have it. Second thing is to make sure that the hospital and the staff is healthy as well, to make sure that it's a safe environment for the patient.
Yeah. Do these measures apply to the staff of the hospital as well?
Yes, everybody, including the doctors, the consultant themselves. We have to go through all the process, the screening, the declaration form, the temperature every day, every single day.
Yeah.
I think most of the hospital, government and the private hospital, they are doing that.
Yeah, because some common places, they only have the thermometer. It's the one that just takes the temperature of the person walking in to any establishment, but there isn't anything else. So it's good that Columbia Asia Hospital PG actually have these forms. If anything, they can be held accountable.
Yeah, because for the temperature screening itself is not sufficient, because some patients do present without history of fever. So only about 80% of the patient will have fever, but there is still about 20% that doesn't have fever. So you need to actually ask for other symptoms, the respiratory tract infection symptoms, cough, sore throat, difficulty breathing, and
So actually symptoms can be different for different people, generally.
Yes, correct. Even there is some report from Germany that about 2/3 of their patient is having anosmia, which is actually loss of sensation or smell. 2/3 of their patient. And in South Korea, they report about 30% have loss of sensation of smell as well. So loss of sensation of smell also is one of the symptoms for COVID-19.
I see. That's all very scary. Well, even more so that you have to strictly adhere to social distancing. That's actually a message, especially for those who are still out there gallivanting like there is nothing going on. Very irresponsible. Anyway, there is a question here by Ms. Tricia Au. Hi, doctor. Good morning. Going back to the bank note situation mentioned earlier, how long does the virus stay on the bank notes? And if a person infected with the virus sneezes or coughs, how long does the virus stay in those droplets? Thank you. So 2 parts to this question, doctor.
Okay. Hi, good morning. Basically, there's limited data. If you check the WHO website, basically they say that it can be, the droplet can be present, can last for hours to days, and depending on the different types of surfaces. But there's still insufficient data to confirm how long the virus will actually stay on the certain surface. So the most important thing is that you need to actually take care of your hygiene, your hand washing, and just make sure that you do not touch your face, because it's spread by droplet. So so you just need to maintain a very good hygiene, wash your hand regularly, then it should be sufficient.
Okay. All right. We'll see if there are any more questions. Oh, we do have one. Ms. Josephine Lim. Good morning, Dr. John. We understand that COVID-19 test has been made compulsory prior to admission to hospitals, regardless whether you have symptoms or not. So as a patient, we will be charged with this additional test cost. I'm not sure whether you are the right person to be answering this question, but perhaps if there is something that you know.
Yeah, basically, if they are medical related, if they have symptoms and they have risk factors, definitely we need to do the COVID-19, because it's a pandemic situation currently. So there is charges for the COVID-19 test. In respective for the other test, that one for the other cases that is the patient doesn't have symptoms, and that one I have to actually go back to my hospital and then get the relevant people. Maybe later we'll contact Ms. Josephine, and then we'll inform you about the charges price.
Yeah, we can do that. We'll go back to the comment section and we'll address that. Thank you, Ms. Josephine. Let's see if there's anything else. Do you have any other questions? If no, it's okay. We can still accept questions. You can just leave your questions in the comment section below, and we will get Dr. Jonathan to answer those questions right after the session. Thank you very much, Dr. Jonathan. With that, we shall end our session for today.
Thank you so much. Yes, thank you. And stay safe.
Bye.
Okay, thank you.